get started with today. I think today's topic, I just feel really loud. Sorry. Today's topic, inshallah, should be beneficial for a couple of points. On one hand, it's not going to be anatomy heavy. So I know at this point you guys are just trying to make do with what you're getting. So this is, you can consider it as a lighter lecture today. The other piece that I guess is more beneficial is the fact that it really tries to integrate a lot of what you guys have learned throughout the year. So not just what we've been discussing in MSK, but things from previous blocks, and we'll try to bring up some examples. I personally am really excited about this lecture because kinesiology is what inspired me to become an anatomist to begin with, and so I'm really happy to be able to just spend some time talking about this discipline and at least sharing a little bit of my appreciation for it in hopes that it's something that you can appreciate even to a small degree. So basically, when we are learning kinesiology, we're learning about how our body interacts with the world and how forces within our body interact with each other that allow us to facilitate movement, right? And again, by now you should be able to pick up on the fact that these are concepts that you're applying from a day to day. These are concepts that have been applied by you, your parents, your grandparents, and we're just trying to understand the science behind it all, okay? And so to understand the science behind it all, there are going to be some terminology that we're going to go over today, and hopefully some of it will be familiar to you. We're going to discuss once again anatomical planes and axes of motion. We'll differentiate between kinematics and kinetics, what that means in relation to human movement. We will talk about joints and how or muscles and how they act on joints. We'll introduce some really basic biomechanics principles, and then we'll try to relate that to clinical relevance and potentially some injuries, okay? So as I opened up with this lecture, kinesiology is about movement. So it's a vast discipline that studies movement and all factors related to it. And so this little diagram is just capturing the tip of the iceberg. Kinesiology can include looking at, psychology. So what are the psychological influences or factors that are related to movement? It can be related to motor control and motor learning in children. How do they learn movement and what makes it different from adults? My graduate training was in this area right here, exercise physiology. I was really interested to see how movement regulates musculoskeletal remodeling in children and adults. And there's so many other issues, or not issues, or factors in kinesiology. And so the area that we're primarily focusing on today is biomechanics. And so what is biomechanics? It's a subfield of kinesiology that focuses on the application of mechanical loads and forces that are going to eventually translate into movement. Now, to distinguish this from another term that tends to come up quite a bit, sports medicine. So sports medicine, you can think of it as the rehabilitation, diagnosis, treatment, the management of exercise-related injuries. And so sports medicine is a really nice merging between kinesiology and medicine, okay? Kinesiology is the science behind it, and biomechanics is a subfield, and then sports medicine is a clinical practice. So how do we describe movement? We've been learning about different ways to talk about movement. So number one, we've learned that movement occurs between articulating bones, right? We have these muscles that are overlapping joints, and when they contract, these bones articulate, coming closer together, okay? We learned that movement takes place in planes and axes of rotation. So whether it's the frontal plane, the sagittal plane. And we've also learned that joint structure plays a really big role in the amount of movement that we can see, right? Or the nature of the movement. So an elbow is going to move differently than a shoulder, right? And that's because of the way the bones are shaped, right? Does that make sense? Yes. Okay. And so all of these things, what they're basically telling us is they're telling us where the movement is taking place, the direction of the movement, and the magnitude of the movement, right? How much movement we're getting. So let's start off with some concepts that, again, are introductory here. So directions of movement, they take place in anatomical planes, right? So as by now, we should all be familiar that if I'm in an anatomical position, okay, and if I am flexing my arm, right, that movement is taking place in what plane? Sagittal plane, right? So remember, sagittal separates right and left, okay? Is that familiar? Okay, so it separates right and left. Now, in addition to the plane, I also have an axis, right? The axis of rotation. So if you think about my shoulder as I'm flexing, and imagine there is this imaginary line that's going through the shoulder joint, that is my axis of rotation. And so for all movements, the axis of rotation is going to be perpendicular to the plane. Does that make sense? So I'm moving in a sagittal plane, but my arm is moving around an axis that is perpendicular. And so the name of the axis, it depends on what plane you're looking at. So for a sagittal plane, the name of the axis is coronal axis. So you just swap the plane terminology, okay? Another name that you might come across is medial to lateral, just because it describes the direction of the axis. So medial-lateral axis. That's the axis of rotation. When it comes to frontal plane movements, okay, if I am now abducting my shoulder, what plane of movement is this taking place in? Frontal plane. And so can we guess what axis of rotation it would be? Exactly. So the sagittal axis, or it can also be called the anterior to posterior axis. Now we're imagining a line that's going to my shoulder from the anterior to posterior direction. Okay, so that's basically what the axis of rotation is. Always think it's perpendicular to the plane. And the last one is transverse plane. So when I'm basically twisting, right? Okay, or when we talked about pronation, supination, right? These things are happening around a transverse axis. So if I took a piece of paper and I poked a pencil right through it, imagining the pencil as the body, that piece of paper would be the transverse plane. Okay, or you can call it horizontal plane, they're both the same. And it's happening around what axis? A vertical axis, or depending on the resource, they call it longitudinal axis because it's long. Okay, so those are planes and axes of movement. And so here's a quick check-in then. So if we're taking a look at this movement being performed, what plane of movement is primarily involved here? So, oh, I hear both. So do we think, remember, if I'm moving like this, that plane is dividing me into right and left halves, right? So this is a sagittal plane, right? Or another way to think about it, what plane can I see the angle of the joint clearest? Okay, if I'm looking at this person from a frontal view, can I appreciate the angle that's changing here? So if you were standing in front of me, and I am flexing my knee, can you appreciate the angle? No, because you're looking at me from the front. You're seeing my limb move, but you're not appreciating the range of movement, okay? So that's another way to think about it. Think about the plane where you can see the angle actually change. That is most likely the angle, or sorry, the plane where the movement is taking place. Make sense? Okay. How about this movement? Transverse, right? So again, think about that pencil analogy, right? So if you have an imaginary piece of paper, okay, going through this person, and so they're moving like this, right? We're appreciating this movement from a transverse plane, okay? So here's a question for you, just to try to start applying the MSK we've learned here. What are the muscles that are facilitating this movement, right? First of all, what is this movement called? Okay, good. So I have hip flexion and okay, so what are some muscles that you guys learned about that are facilitating hip flexion? Iliopsoas. Iliopsoas is a really powerful hip flexor. Good. Sartorius also. Fantastic. Rectus femoris. Yes, good. What about the knee flexion? Or you guys are getting into it? Sartorius plays a role. Yes, exactly. You'll also be learning more about the muscles of the leg. Okay, good. So these are some of the movement. What about what's happening on the other image? Abdominal muscles, right? So do you guys remember abdominal obliques, oblique external? So these are muscles that are allowing us to twist our trunk, okay? That's what's facilitating that rotational movement, okay? Good. Okay. Now, it's easier to talk about movement when you're dealing with these clear classic plane examples, but the reality is we have functional movements, okay? So this is a table here that's just simplifying some day-to-day examples. So for example, if you're looking at, stepping into the car with one leg, okay? So if I am, I've opened the car door and I'm facing, the road ahead of me, I'm going to abduct my hip to get into the car, right? That's what the table is telling us. But there's more to it than just abduction. So remember, true functional movement is happening at multiple planes at once. Because yes, I am abducting my hip, but I'm also, what else am I doing? I'm gonna lose my balance here. I'm also flexing, right? So in other words, the hip is going to be going through multiple planes of motion to facilitate this simple act of getting into my car, okay? So that's something important to keep in mind, that yes, we are really, simplifying movements according to specific planes, but in reality, our joints are moving in multiple planes at once, okay? So that's just something to keep in mind. So let's transition into then joint movement characteristics. So when we talk about characteristics of the joint, we can describe them based on their degrees of freedom or their range of motion. So degrees of freedom is something that you should be familiar with, but maybe it's disguised with a different name. So for example, degrees of freedom is referring to the number of independent planes a joint can move in. So when we think about biaxial joints, for example, do you guys recall what those are? Condyloid, and then what about a uniaxial joint? Hinge joint. So what you guys are describing are different kinds of joints, right? And so uniaxial joints, they move in one plane, therefore they have 1 degree of freedom, okay? Biaxial joints, they move in 2 planes, therefore they have 2 degrees of freedom, okay? And then multi-axial planes, what's an example of multi-axial planes? The ball and socket, right? Because I have flexion, extension, abduction, adduction, and rotation, right? Remember, circumduction is an angular movement that is associated with the biaxial joint, okay? Right? Because biaxial joints, they allow for, so if I, for example, my wrist, okay? Flexion, extension, abduction, adduction. This is circumduction. It's a combination of, so this is circumduction. Circumduction is not rotation, okay? It's a combination of flexion, extension, abduction, adduction, right? Whereas this is rotation. This is happening at its own longitudinal axis. And you'll also feel it's relatively smooth. It's pretty smooth in comparison to circumduction, okay? Right? So multi-axial planes are going to have 3 degrees of freedom, all right? So that's in reference to the number of planes a joint moves in. Right? Now, there's also range of motion. Range of motion is the actual angular measurement that takes place when you move a joint, okay? So you can see here on this image, you can see someone extending their arm, abducting their arm, and you can see that we can actually measure the degrees that represent the range of motion, okay? And so clinically, this is called goniometry. So when you're measuring the degrees that are being completed by moving your joints, okay? It's important to keep in mind that the structure of the joint, the muscles, the ligaments surrounding the joint, all these things are going to influence range of motion of a given joint, right? So again, the range of motion of an elbow joint is not the same thing as the range of motion of a ball and socket joint, right? Does that make sense? Yes. Okay. It's also important to keep in mind that depending on the task, a given joint can exhibit different range of motion. So if I am trying to place this remote over a shelf, wow. If I'm trying to place a remote over a shelf, that's a far greater range of motion that I'm displaying than if I'm just trying to place it over the table across from me, okay? So at a given joint, we can see different range of motion. You're probably wondering, why are we reviewing this? We're past all this degrees of freedom and axial joints and blah, blah, blah. There's a reason, right? You learn about joints, you learn about muscles, you learn about the ligaments that basically hold them in place. If there's some kind of functional deficit, that's going to affect the number of degrees of freedom and the range of motion of a joint, okay? And that can impair the entire extremity that's being involved. And so that's why clinically we assess for range of motion, right? That's where the goniometry comes in. So if you guys remember, those of you that took, calculus or physics, that little protractor tool to measure the angles, this is the same thing but for humans, okay? So you basically, if you're trying to assess the degree of flexion for a patient's knee, you place the goniometer to measure that, okay? And so depending on the injury or the deficit, that can tell you just how much they're able to flex, how much they're able to extend, okay? And so there are certain things that will affect range of motion and degrees of freedom. So, for example, injury, inflammation, surgery, right? While that person is rehabilitating, their range of motion is going to take time for them to achieve optimal range of motion. And if we do have reduced range of motion, regardless of what the reason is, that can influence day-to-day things like gait, physical activity, even our rehabilitation outcomes, okay? So that's why we revisit these concepts, because they will come up again and again, especially if you have patients that have musculoskeletal injuries, all right? Okay, so now we're gonna transition into kinematics and kinetics, right? When we talk about flexion and extension, the subspecialty or the name of this is called osteokinematics, right? Because we're looking at the movement across bones or across joints, right? Kinematics is looking at the movement of the human body as a whole, okay? So it looks at things such as velocity, acceleration, the position of that structure in space. And before you start worrying about, oh my God, do I remember my physics? Don't worry, we're not gonna deep dive physics here. We're just going over some basic concepts for you to keep in the back of your minds when you're learning anatomy and when you're going through application questions, okay? So let's see if we can demonstrate kinematics here. I'm going to play this little clip of someone jumping, and I want you to take a look at the clip and just pay attention to how the body's position changes during liftoff and during landing, okay? It's a really good jump. I can't even do that. No. So I'm going to play it again. And this time, I'd like someone to just briefly explain what's happening in your own words. What is taking place? How is the body changing its position during liftoff? And how is it changing during landing? Just use everyday language. You don't have to get into plantar flexion or anything, just basic. He's squatting, so his body is coming down. Okay, good. What else?
Using his hands back.
Yeah, so he pushes up with his ankle and his knees to jump. I heard something here.
He's using his arms to move out.
Yeah, he's using his arm to swing, right? Right, good. What else? What about by the time he lands? Is he slower? Is he faster? He slows down, he decelerates. Good. So this is basically describing the movement of the body, the motion of the body. That is what kinematics is. Kinematics describes the movement of the body in space, okay? And so what we're not, appreciating here is as this jump is taking place, all the joints are interacting with each other and surfaces to produce these kinematic chains of movement. And so this brings us to this concept here, open kinematic chains and closed kinematic chains. Has anyone ever heard of this term before? Okay. So open kinematic chains, bring back my little pointer here. These are movements that take place when the proximal segment is fixed, it's not moving, but the distal segment is moving. And when the distal segment moves, it's moving independently from my fixed segment, okay? So here's a nice example. Here you have someone, right? I want to focus on the leg that's being swung in the air, okay? So he's raising his right leg to eventually step onto the stool. But before he actually lands on the stool, his distal limb is in space. He can swing it without having to change the position of the rest of his body. So this is an open kinematic chain, right? Can you guys see? So I'm able to swing my leg, and as I'm swinging, it doesn't change the position of the rest of my body. I can change the position of my foot regardless, okay? This is an open kinematic chain. Another example is if I'm holding a dumbbell, okay? Yes, this is weights, right? But I'm still able to move the dumbbell, right, independently from the rest of my body. My body isn't having to adjust because of the dumbbell, okay? These are examples of open kinematic chains. They vary from what we call closed kinematic chains, okay? Closed kinematic chains is when you have the distal segment, it's fixed, and when it moves the rest of the body with it. So when this person fixes their foot onto the stool, and now they're going to extend their knee, their entire body is going to go up, right? I don't have a stool to show you, but their entire body is going to move up with it, because why? The leg is planted to the ground. So when the knee extends, the rest of the body goes with it. This is a closed kinematic chain, right? Because now it's not fully independent. That fixed limb, the muscles around that joint, the muscles around the joint are going to contract, and they're going to move the rest of the body with it. Another really good example is doing push-ups. So if you're on the ground and you're doing push-ups, and as you're extending your arms, your body, what is your body doing? Yeah, it's lifting up, it's lifting down, it's lifting up. Right now I'm doing the same movement as I would do with push-ups. Is my body moving in relation to my hand? No, so this is what? Open kinematic chain. See, you got it. So that's the difference between the two, okay? So here's a check-in question, and I'm hoping from this check-in question we kind of get a sense of why does this matter. So let's read. We have a patient recovering from a knee injury demonstrates good seated knee extension during rehabilitation, but still struggles to rise from a chair and climb the stairs independently. So looking at this case, number one is asking you which movements represent an open and closed kinematic chain. So which one do you think is open? Seated knee extension, right, exactly. So this person is sitting down and they're able to extend their knee. They're fine, okay? Which one is a closed kinematic chain? Right. Okay, so here is a follow-up question. Is going up the stairs a fully closed kinematic chain? Good. I'm glad that you guys caught that. When you look up the stairs, there's a moment in time where your leg is swinging in the air, and then there's another moment where it's planted on the ground. So walking up the stairs is a combination of open and closed kinematic chain, right? Whereas just extending your knee from a seated position, that is open, okay? So, good. Now the follow-up is, why might the patient perform well during seated knee extension, but still experience difficulty during standing and stair climbing? Good. So it takes more effort, right? Why does it take more effort? What is it that's happening? You're bearing more weight, right? Good. And as you guys you're learning by now, there are multiple muscles functioning together at a given joint, okay? So perhaps when they did the knee extension exercise, the quads, they're managing quite well, right? And so that's why you can isolate muscle movements with open kinematic exercises, right? But then when they were going through closed kinematic movements, there is an interplay. Like you guys said, there's more weight, muscles have to coordinate together, perhaps one of the other muscles of the knee are still injured, right? So that's why, right? And so this question kind of brings you why it's important to understand these differences, because some exercises can help you to isolate a given muscle movement, and others allow you to see the coordination of muscles in relation to weight. Does that make sense? Yes. Okay, good. So, that was kinematics. Okay, so kinematics, again, it looks at the movement of the body in space. Kinetics is what we don't see. So kinetics involves the forces. What are the forces that are taking place that produce movement? Okay, what are the forces that are taking place? What causes the body or a given segment to move? That is what we call kinetics. And so a force in this case is defined as a push or a pull on a given object. And when it comes to biomechanics, we can divide forces into two categories. We have external forces, and so these are forces that are acting on the body from the environment. They include things like gravity, ground reaction force. So when I am stepping onto the ground, just as I am pressing onto the ground is also pushing back against me, okay? Right, whether I'm standing or whether I am stepping onto it, the ground is pushing against me. So that's ground reaction force. Resistance from an object, so if I'm holding something, right, there's a resistance from that object. Those are external forces, okay? Internal forces, on the other hand, are generated by the body. So muscle contractions, ligament tension, joint reaction forces. Joint reaction forces, this is not the same as ground reaction force. So joint reaction force is the forces that joints put onto each other, right? So basically the interaction between the hip joint and the knee joint, for example. Okay, that's what the joint interaction force is. So this image really nicely summarizes that. So you can see here we have external forces that are acting on the sole of our foot as it's touching the ground. And then we also have internal forces coming in from the muscles and the ligaments that are supporting the ankle. Does that make sense? Just to put this in a bit more practice, here is a marathon runner who put biosensors on his body and is running in slow motion. And what's really neat about this is that you can see those structures that are generating both internal and external forces, right? So all the muscles here, as well as the ligaments, they are generating internal forces, okay? And this is counterbalanced by, you see the lines that are showing up, the red and the blue? Okay, these are ground reaction forces that are acting against the internal forces that you're generating when you're running, all right? Same thing over here, except now the runner's creepily coming towards you, okay? You can see here the ground reaction forces in blue, and they show up really in high intensity the moment he basically lands on the ground, all right? My brother is a biomedical engineer, and he does this for fun, so it's actually a fun exercise. Anyway, I say that because once I went to his lab and he allowed me to play with this equipment, and it was fun. Anyway, okay, so now we're going to focus on internal forces, okay? Now, internal forces, we can subdivide them into being contractile, and the name should tell you what kind of structures are there, and non-contractile, okay? So, contractile forces are generated by muscle, so muscle contractions, right? And so muscles are going to contract to produce, to control, and to stabilize movements, right? Because we said muscles, they are also known as dynamic stabilizers. They work together to stabilize joints in addition to moving them, okay? Now, as you may recall, we can categorize muscles into different groups. So we have agonists, we have antagonists, synergists, right? Fixators. So, for example, if I'm kicking a ball, right? What is the agonist in kicking a ball? Yeah. So the anterior compartment of the leg. Okay. So those are the agonists. They're priming the movement, right? And what is the antagonist? Posterior compartment, right? The hamstrings. Good. What are some fixators here? Your core, right? So perhaps some of the gluteal muscles here, they're stabilizing, right, as you are working, okay? And some synergists, this is where the knee joint, the knee and the hip, okay? So when I am kicking a ball, if I'm focusing just on the knee, in this case, the hip is a synergist because I need to flex my hip in order to kick the knee, okay? Does that make sense? Again, this is something to keep refreshing on as you're practicing your studying, but the takeaway from this point is that muscles perform in different roles, okay? Now we also have what we call force couples, right? I think you guys might have talked about force couples when you were talking about serratus anterior a little bit. So force couples are when you have muscles, they're acting in different directions to produce a unified movement, okay? So in the case of abduction, what's taking place is the scapula is rotating, right? And so here is an example of a force couple. You have the serratus anterior and the different fibers of the trapezius muscles. They're all holding on to the scapula in a different way, and together they're contracting to facilitate its rotation, all right? So this is what we call a force couple, okay? And this is, again, these are key descriptions of contractile forces. Non-contractile forces, these are not being produced by contractile muscle, okay? Instead, they're produced by structures that are providing that static stability. So ligaments, fibrous capsules, okay? And the way that they do it, they contribute to stability by limiting excessive movement. So if we look at our good old shoulder joint over here, once again, you can see we have the glenohumeral ligaments that are really crucial because remember, we said that the glenohumeral joints, if we're just looking at the bony articulation, it is very mobile, okay? So these ligaments, they are creating tension to hold that joint in place, okay? So they basically help with that stability, and they also, non-contractile forces will help with transmitting forces. So what do I mean by this? When you have a dumbbell or something really heavy, and you're lowering, right, you're working with the weight of the dumbbell, you do have connective tissue in your muscle that's going to essentially lengthen to allow you, or to stretch, to allow you to drop or basically lower that structure nicely and slowly. So transmitting the weight, okay? So this is just, again, an example of how non-contractile forces are helping to stabilize joints and to transmit forces from one area to another. Make sense so far? Okay. So, we're gonna do a thick pair share. Do you guys know what a thick pair share is?
Yes.
Okay, yes. Oh, sorry guys, we're almost there. So what I'm gonna do is I'm gonna ask you to talk to the person right next to you, okay? And I want you guys to consider this question. So basically, consider a person rising from a chair. Which muscles generate contractile forces during the movements? So I want you to be specific. You guys are getting into the lower limb. You should start knowing this stuff. Which passive structures contribute to joint stability? And what is the external force that's acting on the body during movement? So I'll give you guys like a minute or two to discuss amongst yourselves, and then we'll take it up together.
I can't think of my physics to be honest. Gravity is the ground. You can just say the ground. What about the third?
I really like the ones that are doing the exercise. This is good. This is a lesson for everybody. Move around to figure it out.
C, ground forces. 2, we don't know what's 2. When the fast structures which one? That's her the hip, the knee, and
Okay, should we take it up? All right. You hip enthusiasts. Let's take this question up together now. So, who wants to share their response for A? Which muscles generate contractile forces during the movement? Gluteus maximus. So what is gluteus maximus primarily doing here?
extension.
Good, right? It's a really powerful extensor. Okay, what else? Okay, what are they doing? Extension of the knee. Good. Okay, so we covered the different joints and their movements. Good. Now, what are the passive structures? So we covered the muscles that are facilitating the sit to stand. What are the passive structures that are playing a role here? Remember, muscles are not acting on their own. The joint capsule, right? Of what? The knee, the hip. Okay, good, good. The calcaneus tendon is also supporting the leg. That's good. Yes. So the calcaneal tendon. So those are part of the hip joint. They're supporting the femur in place. What about the ligaments of the knee? Do you guys remember which ones? ACL, PCL, support extension. Which ones become taut during extension? Tight. The collateral ligaments, right? Yeah, remember the collateral ligaments on the side? So they become tight during extension. So by the time the person is completely stood up, those ligaments are tight. They're stabilizing the joint, right? Otherwise, when they are in from sitting to standing, they are relaxed and they become tighter, okay? Perfect, okay, good. So we've established some of the ligaments, some of the joint capsules. What are the external forces acting on the body during movement? Good, so we have gravity, right? That's pulling the body down. And then we have the ground reaction force that's acting against it. Good job, this is easy for you. Yes, so the pull of gravity. Exactly, yes, you got it. Good job. Okay, so we're approaching the final concept of the day, okay? So hopefully we'll be able to end pretty soon. So we're approaching the concept of torque and movement, right? So as we said a couple of slides ago, okay, a force, right, is basically a push or a pull on an object to generate movement, okay? So if I'm looking at something linearly, okay, a force is needed to generate displacement, okay? Muscles are not behaving linearly though. We have this sort of angular movement that's taking place, right? We're moving around axes, okay? So we call these angular movements or rotary movements. And so instead of using the word force, we use the word torque. Does that make sense? So force is what I use to say for something pushing against a linear object or producing linear motion. And torque is producing that rotary / angular motion, okay? Make sense? So that's what torque is. And so the body, right, is at a constant state where it's generating torque, so there's an internal torque, and it's also counterbalancing external torque that's coming from the environment. And so when those are equal, there is no movement. So for example, see this image here? We have this basic schematic of an elbow, and it's holding a ball. Okay? So right now, the torque that's being generated by my elbow and the torque that's generated by the ball, they are roughly the same. The moment I start working my muscles so that I can bring the ball from here to here, I have increased the torque, my internal torque, so that I can produce that movement. Does that make sense? So when torque from the environment is the same as torque in the body, there's no movement. But when you increase your torque, all right, that force to create that rotational movement, okay, that's where you see movement, okay? Now, how can we assess for torque? Because that's something that, again, could come up. Ladies, I just want everyone's undivided attention. All right, we're almost wrapping up. Bear with me, okay? So how can we assess for torque? So torque, right, it can be quantified by taking the product of the force, the weight, times the distance, okay, times the distance of the load and how far it is from the axis of rotation, okay? I share this equation because I don't want you to worry about making any calculations. You're not going to be calculating for anything. But I'm sharing it here so that you can appreciate the relationship that as the load increases and as the distance, which we call moment arm, from the axis of the joint increases, we have a greater torque, all right? Let's try to put this into simpler terms. Here's an image. We have A showing us someone squatting in a deep seat, and then you can see them as they are rising back up with their knees slightly flexed, okay? The red line is indicating the pull of gravity, so their weights, okay, that they're working with. And you'll notice in both images, the weight is the same. The pull of gravity is the same. You have basically the amount of force that's being externally applied to the body. The yellow here is showing us the joint axis around the knee. Okay, everybody following so far? Yes. The moment arm is the distance between the joint and the force, okay? And so you'll notice that the moment arm here, when I'm in a deep seat, is a lot bigger than the moment arm here, when I have extended, right? And the reason being is that all of this weight in this initial image was very far from the knee joint, which means in simpler terms that the muscles of the quadriceps have to work really hard to support this weight because it's really far from the joint. But as I'm extending, okay, now this weight, the pull of gravity, is closer to the joint, and so now the quadriceps aren't working as hard. And so relate back to the last time you did a squat, okay? When you're in that deep seat, it burns, right? It's burning because the weight is really far from the knee. But once you start rising back up, that burning sensation, slightly, declines, right? Because now your weight is closely aligned to the knee joint, okay? This is what we mean by torque. Here in A, there's a greater external torque applied, so the muscles have to work harder to exceed their internal torque. Does that make sense? Yes. And then here there's a smaller amount of external applied, so there's a less demand on the muscles to produce torque. Why is this important? When we talk about back pain, right? So there's a lot of, ergonomic videos out there about how to best carry heavy objects, right? And so you're discouraged from carrying things far away from your core. You're typically encouraged to carry something closer to your core. And the reason is torque. If you're carrying something farther away, there's more external torque being applied. Your muscles of your arm and your back have to work harder to support that weight. If you bring it closer, there's less external torque, and so that makes it easier. This is not to say that lifting heavy objects is bad for you, so don't go home and say, sorry, Dr. Yasmeen said I can't lift anything, okay? It's simply saying that this is what happens with torque. And it's also saying that if we expose the body to repetitive movements where there's a lot of external torque being applied, that's where we can see some issues. That can increase the strain on the back, the ligaments of the spine, and whatnot. Is that clear? Okay. So that's what torque is in a nutshell. And that basically brings us to the end of the lecture today. So we opened up by introducing what kinesiology is. We talked about planes of movement and axes of rotation. We distinguished between open and closed kinematic chains. I encourage you to start thinking about your movements on a daily basis and applying that terminology to that. And we introduced torque specifically as it relates to the amount of load that it places on a joint. So here's a quiz. Scan the quiz, please, complete it, and then prepare your phone